Hello everyone, we are at ICM 2025. Thank you for turning. Okay, could you please introduce yourself?
Hi, I'm David Thompson. I'm the CEO of Osteal Therapeutics. So Osteal is a clinical stage company developing a drug-device combination therapy for treating musculoskeletal infections. Right now we have, as our first indication, we have a product in development for treating periprosthetic joint infections. So we are late clinical stage with 2 randomized controlled trials completed where we saw very favorable results demonstrating superiority of our product, NextChange Kit, over the current standard of care for treatment of PJI.
Okay, I want to ask you a question about the infection. Why does the infection matters for you?
Well, you know, the musculoskeletal infection is a highly understudied area of medicine. Despite the fact that both the incidence rate and the raw number of patients is growing quite rapidly around the world as the population is aging and we're seeing an increase in joint arthroplasty. As an understudied area, you know, many clinicians are sort of left to treat these patients in a vacuum. And the burden of musculoskeletal infection on the patient is very intense. It has a very high mortality rate. The morbidity associated with the condition is also very high. And so, you know, and in many countries, there aren't any approved therapies. And particularly, for instance, in the United States, there's no approved therapy for treating these patients. And so there's really a gap in the market where the surgeons and the patients don't have the tools they need in order to help the patients be spared this high degree of morbidity and mortality.
What ICM means to you?
So, you know, in comparison to other clinical congresses, which often are great venues for presenting new information and new data, the ICM serves a really important and unique role. And that is, as I said a moment ago, many clinicians around the world are sort of left in an island. They're treating these patients often with very little data, very little guidance. They're left to sort of come up with their own approach. And that makes it difficult for them to be able to develop best practices. And so what ICM does is synthesizes the data available, both the data and, frankly, the thinking of the best minds studying musculoskeletal infection, and provides the clinical community around the world with guidelines to help them advance their care of these patients in a way that no other Congress really does.
You already answered all my questions. So is there anything you want to say about your feeling, about your thoughts for ICM?
Well, I have to say, this is our first ICM that we've attended as a company, as a sponsor. And it's been a fantastic experience for us. You know, we've had the opportunity to access the best minds in this space over a very short period of time, and that's critical for us as a company that must partner with our clinician partners in order to develop the right clinical programs, the right product development, and make sure that we are emphasizing and highlighting the things that are the most important to them and their patients. And so ICM has afforded us an opportunity to have access in a way that otherwise would be very, very difficult. And so we've just had a fantastic week. We look forward to the remaining day tomorrow, and definitely we'll be back at the next one, and we hope that these become a very regular event.
Yeah, we are glad to hear that. Okay, thank you so much for your time.
Thank you. It's a pleasure.
Okay, my pleasure.